ahead and get started. Thanks for coming to this communication seminar sponsored by the Prevention Research Center and the Maternal Child Health Leadership Training Program. Today we're very happy to have Kari Schulman, who is a clinical assistant professor here at Tulane and Director of Health Education and Communication for the Maternal and Child Health Program at the Louisiana Office of Public Health. She's been with the Department of Community Health Sciences here since 1993 and holds a position at OPH in the Maternal and Child Health section, where she directs and oversees several health communication projects related to maternity and women's health issues. Here at Tulane, she teaches courses in health behavior and risk reduction, health communication, and social marketing. And she received her MPH from Tulane and the Free University of Berlin, and she did her undergrad studies at Tulane and in Hamburg, Germany. So we're very happy to have her. Thank you.
Well, thank you. Well, it's good to be here. And what my job today is to get this clicker to work. Okay. All right. So my job is to tell you the story today. So once upon a time, in a land not so far away, actually right down on Poydras Street, when you get into the address, and not so long ago, about 2 years ago, the state's maternal and child health program decided to integrate a social media component into their health communication efforts. And so this is a story. But before I start with the story, I want to give a little bit of a disclaimer. And one of them is that I am not a social media expert. I am usually feeling quite overwhelmed when I really start diving into, all social media kind of things. But what I do want to do is tell you the story of us trying to integrate a social media kind of strategy into our health communication programs. So the other disclaimer to the story is that it's not a big, wow, dramatic story. It's just a story. So I hope you're not too disappointed with that as an introduction. So anyway, so it starts with the numbers. So when we look at social media, there are now more than 800 million active Facebook users, with over 200 million that were added in 2011. And over 80% of all Americans use a social network. Nearly 23% of online time is spent on social networks. And Facebook is actually one of the top destination sites for among social networks and blogs. What has happened, as you are probably very familiar with, is that there's been an explosion in the use of social media. And so, just tracking it from 2005 to 2011, we can see 83% of all those between the ages of, I think this is 18 to 29, are social network users, etc. And certain groups are growing faster than others. So there's an explosion. People are using social media and social networks to communicate with one another, to get information, etc. So that's part of the story, right? Of social networking, about 92% partake in Facebook, 29% participate on MySpace, we have 18% on LinkedIn, 13% on Twitter. And here's some information that I pulled recently. 1 out of 8 couples married in the U.S. last year met via social media. So, there is an impact here. Ashton Kutcher and Ellen DeGeneres combined have more Twitter followers than the population of Ireland, Norway, or Panama. So, and then this I thought was interesting too. In 2009, Boston College stopped distributing email addresses to incoming freshmen because basically the Generation Y and Generation Z consider email passé, which is quite scary to me. I'm so attached to email compared to social media. But anyway, so just some things to frame this conversation about social media. Other things that just came out in a report in, I think it was September of last year by the Pew Internet Research, is that these are some words that are associated with, social media, positive words, good, fun, great, interesting, convenient, excellent, all the way ranging between positive, negative, neutral, and some notable kind of words. But the research showed that most people did have a positive spin on social media and its applications and uses. So the numbers were in part part a big driver for us in the Maternal Child Health Office of the state to join in the social media. It seems that there's almost an obligation for us to be there where our audiences potentially spend time and hang out. And the social media also has a very interactive nature, so it allows for greater audience participation and engagement with some of the messages. And as we know in public health, behavior change is not easy. It's not just about, developing a TV spot, showing it to someone, and then oops, behavior change happens. So social media has the promise of interactivity with your audiences and some give and take. So that has some interesting implications for us. And then from a theoretical perspective, in mass communication, use and gratification theory basically reminds us that audiences are very active users and have an active role in any kind of mass communications. It's not just what the media does to them, but they seek it out and have a purpose and use for using media. And so this, for us, if we are going to engage in social media, we have to think about this kind of a perspective and make sure that the communications that we send out are entertaining, are interactive, are fun, do engage our audiences. And the last big reason really to join into the social media bandwagon was really to get experience in developing and using this channel. We had to jump in and join in. That was the thinking that went out. So there is how Sammy the Stork was born. Back in 2009, he was part of a Stork Reality, a sub-campaign of a larger project called Partners for Healthy Babies that was reaching out to women in Louisiana to promote prenatal care and healthy behaviors during pregnancy. And one of the things that we were working on in terms of low birth weight and infant mortality reduction was to move downstream a bit more and begin to bring in the preconception health message, the importance of women being healthy before they even get pregnant. And so we had a project called the Stork Reality, and this Sammy the Stork was born in that project. It was a multimedia campaign, and I'm not going to really tell the story of that campaign. That's a story for another day. But the campaign featured an actual 7-foot stork, and we called him Sammy. And he went around and visited bars and restaurants and festivals all throughout Louisiana, engaged and interacted with audiences. We had a video team that followed him around and videoed him, and these videos were posted up on a mini website. There was also a street team that sometimes went along with him, sometimes they went out solo again to bars and restaurants, and interacted with audiences to really engage them in the conversation about the importance of preconception health in a very unexpected, kind of quirky, funny way. We also did use traditional media, TV, radio spots. We did in-bar advertising in terms of posters and bathrooms and bar posters and mirror clings that were actually stolen off the mirrors, which we thought was a great sign of success. And we had the social media component. So this is where Sammy Stork kind of began to live on social media. And so upon graduating from the Stork Reality, Sammy became the spokesperson for the larger maternal and child health program, not just focused and related to preconception health issues.
This was a live stork?
He was played by an actor, yes.
Oh, okay. Okay, it was not a bird.
Well, I don't know if you can see there. It's a street view, actually. But here's some video. This is the mini website where we uploaded some of the videos. Here you can see Sammy. He's actually in a grocery store right here. Right here he's waiting at a bus stop, just trying to engage people who are waiting. He's at a park right here. These are a little hard images. He's actually at a restaurant in here talking to people. So yeah, he was alive. We hired an actor to play him. So anyway, so just a little flavor of that campaign. But as I said, that's another story for another day. So Sammy does have parents and guardians, and so we, as good parents and guardians, we felt like, well, we really want to make sure he has a good and healthy life in social media. So this comprised of a work team at the Maternal Child Health Office, and we collected in the summer of 2010, even though he started in 2009 as having a social media presence through the Preconception Health Campaign, we decided to pull together some of our heads around how is it that we can really use and evaluate social media for the maternal child health program in its entirety. Because a lot of different sub-programs of the maternal child health wanted to jump into the social media kind of environment. And it didn't make sense to have 3 or 4 or 5 different social media presences, you know, when we all really were kind of going towards the same thing. And we also have an advertising firm by the name of Trumpet, who is on the account, who is in part a co-parent of Sammy and helps with the implementation. So I'm going to talk a little bit about the activities that this work team kind of engaged in to make sure that Sammy grew up to be healthy and strong. So, you know, we did have to do some formative research. We developed a plan and a schedule. We talked a little bit about implementation, the monitoring and evaluation that we did, and then a revisit of the literature in the summer and later in 2010 and 2011. So the formative research, the team basically sat down and did a lit review, and what we found really was at this point in time in 2010, there were large gaps in this area of research. There was not much out there in terms of how do you evaluate social media, particularly not for public health or social issues. There was a little bit of something in the related to for-profit, and there were reports of good achievements of using social media for profit and product achievements. And the other thing that we learned was that actually 84% of professionals worldwide did not measure social media return on investment. So they were using it, but really could not say whether this was successful in their businesses because they weren't really measuring it. So that was one thing we found out. The other thing that we did was we actually brought in a local PR firm who specialized in using social media, and in particular for kind of accounts that were related to health, hospitals, and you know, some entities like that. And we asked them to give us a training and provide us with some guidance. And so they came in and advised us to be really careful about how we went about this in terms of making sure that we allocated resources and staff time, because even though social media sometimes is perceived as free, in a sense, you know, there are a lot of staff resources and time that really get eaten up. They also advise us not to do everything. Pick what works and you know, do one thing well if at all possible. And also recommended that we become aware that we're not going to be instantly gratified. This is going to be a slow process. You're not going to, you can't expect a huge return immediately. So these were some pieces of advice that were provided to us by this PR firm. As good public health practitioners, we knew that it would be important, instead of just jumping into the social media activities, to really think through a plan. We did look to the CDC, and they at that point had a social media toolkit, and they have a revised one. I actually have it with me, so if you wanted to kind of just flip through, and I'll give you the resource at the end of the talk today. Basically, there's a toolkit that gives some guidance and advice on if you are interested in joining the social media platform, you know, things to think about to do. So we did put a plan together that included goals and objectives, what were we after, where were we headed. We defined our target audience. We defined the persona and personality of our Sammy Stork, like how we wanted to be. And there were also in the plan guidance on how often we would post, the criteria for befriending and following others, how to handle negative comments, and these kind of things were all documented and put into the plan. And the other thing that we did was we came up with a schedule, a message matrix for an entire year from October 2010 to October 2011 to guide and forecast what we would post about and what we would talk about via these social media conversations. And that was quite helpful, actually. So the goal, this is from our plan, you know, basically for Sammy was to build an online community child health, and communicating about maternal child health programs and maternal and child health related messages. So, and we did populate plan with a few objectives, and I'll report on the progress of those. You know, things like, you know, increasing the number of friends we had, and increasing the number of likes and fans that we had, the number of followers, the number of interactions, and traffic to a website that is part of the Maternal Child Health Office. Target audience, we had 3 tiers that we identified. One was to really, the first tier was to reach out to organizations that were connected to women of childbearing age, so community organizations and things like that. The second tier was to connect to media outlets, and then tier 3 was to actually reach the women of childbearing age, and particularly we were interested in those who had limited resources. Sammy's persona, we wanted him to show that he was very knowledgeable about maternal child health issues and that he was an expert. But we did want him to continue to be a little funny, quirky, witty in the way that he approached his conversations, but also show caring, concerned, likable, and compassionate side. And we wanted him to also be supportive of other groups that he befriended. So these kinds of, you know, very specific outline were included in the plan. And for implementation, the primary gatekeeper, we asked the advertising firm Trumpet to be the primary poster of the messages and to keep up with social media. And the MCH staff also had a very important role in making sure that they provided the content to the advertising firm in terms of what to have those conversations about. As I said, that these were actually outlined on that yearly schedule, so we knew month by month what types of conversations we were going to have, whether we were going to talk about HIV, or whether we were going to talk about immunizations, or breastfeeding, or what have you. And posting did occur several times a week, and then we also made sure to have monthly meetings where the advertising firm and our staff from office, you know, came together to discuss, you know, the plan, changes and adjustments needed, etc. So this is where Sammy actually lives, on Facebook, on MySpace, and on Twitter. And you know, we did care who Sammy hangs out with. So you know, as good parents, we wanted to oversee his social circles. And you know, again, we reached out to, you know, individuals, to nonprofits, government organizations, businesses, media outlets, and entertainment and celebrities. You know, especially wanting to make sure that with entertainment, we have a lot of musicians and bands, and you know, people who in theater and things like that, because we really felt that they would be more connected to our target audience. So we actively reached out to some of those groups and to community organizations as well. And as mentioned, some of Sammy's interests, you know, are the things that he talks about or comments about in his environment are about the other campaigns that the Maternal Child Health Office are engaged in, about child safety, about SIDS and safe sleep, preconception health, of course, substance use, breastfeeding, and other priorities as they come up. Okay, so to monitor and track his activities, there are a few tools available that are free, and they include tracking tools that are available on some of the social media sites, such as Facebook Insights, and Hootsuite is available as well as free tracking. You can get an upgrade and, you know, buy a couple of extra features on the tracking, you know, for $5 or $6 a month. And then Google Analytics is also very helpful to help track click-throughs and things like that. So these were tools that were used to make sure we were able to keep up with some of the objectives that we had listed out. So things that we captured are things like the number of posts, the number of friends, followers, likes, daily active users, impressions, interactions, mentions, retweets, etc. And so this gives you a little idea. So again, this is not an explosive success here, but you know, we're growing slowly. You know, as of January 1st of this year, we had 411 friends. This is Facebook and MySpace combined. Number of likes on page, interactions, comments, news feed impressions, active users in Twitter. So you can kind of get a sense, about the activity on our social media pages. And progress on objectives. So as I mentioned, we did have a few objectives that we listed out in the plan, and they're listed here on the left. And you know, so we look to see in that 1 year, that first year of the objectives, it went from October 2010 through October 2011. You know, what was the progress that we made? And you know, overarchingly, we met our goals. Now, what does that really say? I mean, I think we were very naive in building some of our objectives, but I mean, so we did, you know, increase by, you know, much more than what we had anticipated. And ones that we didn't quite make, almost got there, were the increase of friends and page likes that we were looking for. Another part to our monitoring is the qualitative kind of assessments that we did. The monthly meetings were really, really important to us. What we did there was we actually reviewed all the posts and the comments and looked at those. We, you know, printed those out and really looked at them. I mean, they were not that overwhelming an amount that was still a doable thing. We also wanted to really make sure that we were getting a handle on who we were befriending and who we were engaging with. So we developed a category for our associates, both national and local, and then minority and non-minority, and further broken down into whether it was health and fitness related, or whether it was media, or whether it was businesses, or whether it was entertainment industry. And you know, so those were when we befriended someone, we made sure that we would put them in a category so that we would have oversight in terms of who we were actually engaging with. The other thing that was really important at the monthly meetings was to discuss operational issues, because what does happen with social media is that it's consistently changing. I mean, we ran into that a couple of times with our objectives, where we wanted to count the number of page likes, and all of a sudden that wasn't being, you know, provided anymore. As of this year, they're not doing daily active users anymore. They're now doing something else that's called talking about. So you know, there's always changes, and so you have to be kind of flexible and figure out how to deal with things. And operational issues too. We did make sure that we, you know, if someone was going on vacation, you know, we would take over for being Sammy and doing posts and keeping up with things. So those were things that the monthly meetings really helped us keep track of things. The other thing that we did from a qualitative perspective was to ask a few people to review the social media sites, and you know, really get in there and look at it. It was a few teenagers and young women that we asked to give us some feedback on that. And from these insights that we gained from these qualitative kind of exercises was that, you know, we really, even though we did have a message matrix, you know, we really needed to adjust the message as needed based on what conversations were occurring out there. I'm sorry, my fingers are just too big. The other thing is that in terms of befriending associates, it was not just, it was smart to reach out online and ask people to befriend, but it also made sense to befriend in direct interpersonal relationship and ask community organizations in person if they would want to join the social networks that we were engaged with. And that was very valuable for us there too. And as I mentioned already, the changes in the way metrics were reported by sites was something that you might always have to keep up with and be flexible with. And especially from the consumer feedback, they really wanted to see an increase in videos and fun stuff that was at the social media sites. That was their recommendation. Parents sometimes ask, I'm putting all this effort into this child. Is it worth it? Is he going to grow up to be healthy? So how do you calculate social media return on investment? And one thing that is a big lesson for us is that it really is important to keep up with the literature. It is so dynamic, it's ever-changing. What we found in 2010 and the end of 2011, there was very little on return on investment in social media. By July of 2011, there was a mushrooming of online conversations, blogs, newsletters about social media return on investment, and a lot of different suggestions and advice given. Again, mostly for the business world that had a for-profit kind of interest. But we were wondering, does this help? Okay, so does this help us show that our social media efforts are working? So what does Sammy cost us? It costs us about $2,000 a month to run. That is help getting the messages out, contracting with advertising firms, et cetera. So we're spending about $24,000 a year on social media. One preterm baby costs about $46,000 to get out of the hospital. And that's compared to a healthy newborn, where the price tag is currently at about $3,800, with a savings of $42,000. So if the savings equals a 2-year budget to do social media with Sandy, I mean that could be one way to say, hey, we should keep doing this. But if we have to, in today's very challenging economy, and where everything that we do in public health is being scrutinized and say, well, can you show that it really is doing it? Is this good enough? I don't know. So this is what we would, in the past, would always go to, but it may not be strong enough. So we really do need to explore this return on investment. And the reality check is that, how do you really measure return on investment? It's a very simple formula, which basically is that the gain from the investment minus the investment itself divided by the investment times 100 is the percent of return on investment. So where it's pretty easy to figure out what your investment is, right? How much dollars you're spending on running your program. So converting the hours and the staff time used to create and run the campaign. Now, the return is a little bit more challenging, especially if there is no dollar value attached to the return. So, but we have to figure out a way to do that. And that was kind of the big lesson from our investigation. If you want to measure return on investment, you need to set a quantifiable return. You have to have a very clear goal that can be ultimately transferred into dollars and cents. So, if there is if you do not measure return, if there's no direct financial exchange that occurs, you really have to become a little more creative, and there's no way around it. You have to figure out how to define a return that can be converted into dollars and cents. So, step 1 is calculate the investment. Step 2 is determine the return, which in itself is a 2-step process. Again, identify and define the return. You have to set a very clear, quantifiable objective, and convert that return into a quantifiable dollar value. So return on investment is calculated here. This is your financial investment. This is your financial impact. These are the things that happen in between: action, reaction, and non-financial impact. This is the engagement that you might have with your associates. But this is not where you can measure return on investment. It may be a necessary interim steps, but it is not the way to get the final answer. So, with that said, how can we in public health or for social issues really look at defining a return? So, for public health applications, instead of working with sales, which we rarely do, we may need to look at, well, how much would it cost us to get customer insight? How much do focus groups cost? If we get insights from social media, how can we compare those two things? Or brand awareness. Or, we need to really be creative about the things that we can gain from using social media where we may be able to attach some kind of dollar value. So the recent, I think this was April of last year, this company named Bitrue basically they came up with this value for a Facebook fan of $3.60. But this is, you know, we don't know this for sure yet, but you know, this is something that the social media world is buzzing about. Really a true kind of value. But you know, these are the kind of things that potentially could be helpful to us as we are having to justify our strategies, including those of using social media. So the point is, with social media, if you want to measure return on investment, you're going to have to figure out a return that can be converted into dollars. Other insights that we got from the lit reviews about return on investment was that the business community, at 48%, about half of them really felt that measuring and creating return on investment measures was top of mind for them for the coming year. This was something that they were really going to figure out and deal with. The other thing is that, again, as our PR firm in the beginning, back in 2010, advised us, gaining positive return on investment is going to take time. It's not going to happen overnight necessarily. The other thing would be, maybe we have to not just ask what is the ROI of social media, but what is the ROI of some kind of activity that you might be doing in social media. So, you know, you don't have to maybe look at the whole channel, but, you know, looking at a potential activity that you're interested in. So you may have to pare it down a little bit. And the other thing is that ROI may not always be relevant. So, you know, if it's not relevant, then, you know, you may not have to actually do this exercise. Yeah. So from the lit review and in general, some lessons learned were that there are large gaps that exist in terms of research and guidance for the evaluation of social media in public health in particular. We're actually, in the Maternal Child Health Office, at the cutting edge of this conversation, believe it or not, because we're really trying to figure this out and participating in doing this. If you are only measuring engagement, you know, such as the number of friends and followers and interactions and impressions and things like that, it's still, you're going to have well thought through objectives at the start. So you still need to do that. And still continue doing that even if you're not going to pursue return on investment kind of measures, because it's an important piece of information for you. And if you ultimately do want to go towards return on investment, they are very important intermediate steps. And if it is important for a campaign to demonstrate ROI, then you're going to have to define that return. So overall, some recommendations from this year of being engaged with social media is we were very grateful that we had a plan. I mean, so many times we actually had to refer back to it and say, okay, so wait a minute, what are we saying here? You know, having that plan was critical for us. But we also had to recognize that it was important to be flexible. You know, when we had to go where the conversation was. So if in this month we were saying we were going to talk about car seat safety, yet there was something really buzzing about SIDS and safe sleep, well, you know, we would of course be flexible in that regard. Building in qualitative assessments, I think, adds a dimension and some insights that you'll never gain from just metric capture and return on investment conversations. So the monthly meetings were very, very important to us because it forced us to look at what was happening in the conversations, in the operations of carrying out social media. And you know, getting qualitative assessments from potential consumers also gave us the boost needed to make sure that we added more interactive and fun kind of features. Actually, I do have a little, in October of last year, we decided to do a contest where people would have to, you know, we showed a few pictures and they have to pick out the one for a baby sleeping on its back or side for SIDS and safe sleep kind of environment. They had to tell us which picture was the best sleep environment for the baby. And this contest, because the first 10 who responded or something like that would win a stroller. So we built that into it, and our comments went from like 13 a month to 85. So just in that, you know, doing one little thing like that. So our next plan, and kind of going forward a little bit, does increase a lot of more giveaways and contests and videos and things like that. So that's definitely going into the future. Measuring engagement is relevant, so don't stop. At minimum, it is steps on the way towards return on investment. So make sure you do keep up with the metrics. There are a lot of metric tools that are available that are free. There are some that you can actually spend a bit of money on that promise everything, but also promise to eat your budget up. So using the free stuff, whether it's Hootsuite or the Facebook Insights or things that are available on Twitter are important things to look into. Make sure to attend to operational issues. The way that metrics are captured and how social media and MySpace or Twitter, does its operations can change, from one month to the next. So just keeping up with those things is important. And we also recognize the importance of integrating social media with other programs and other initiatives, making sure that we had our website and our helpline and other initiatives that are national. For example, Text for Baby is a national social networking kind of outreach to pregnant moms and new moms. And so we're making sure that we were integrated with that. Again, the fun stuff in videos, keeping up with social media trends, really important. So, I subscribe to a couple of blogs and newsletters just to kind of keep things fresh and knowing what is happening in this world. And the last thing here on this list is to build an online community, not only, as I mentioned, from the online reaching out and interactions, but offline. Meeting people and sharing your social media sites with them. And if you really want to know who you're engaging, you're going to have to build some kind of tracking. And I know Facebook has made some changes where you can kind of start grouping people into your friends are not all alike kind of thing. But prior to this change with Facebook, we really had, and we still are continuing to do this whenever we befriend or follow someone, we put them in a little bucket so that we know what is actually happening with associates. Where we're headed in the next, in this actually current year, is we're finalizing our annual plan and including a modest ROI objective for part of the social media activity, and one that's related to gaining consumer insight. We have not fully thought through that yet, but this is going to be built into the plan. We do have a new message matrix for the year that includes more giveaways, contests, and we're actually partnering with another company to help us with giveaways, and kind of interacting and linking with others is important. More fun stuff in videos, more integration with our own website, so that means some changes on our website to make sure that we interact more with our social media sites. We're also going to add a blog on the website that might not be till towards the end of this year, but that's in the works as well. And having the maternal and child health staff actually spend more time being Sandy. Right now, the advertising company is the one who's being him, and we're the ones who are trying to monitor and track everything. But we really need to spend more time actually, taking a week or a month to be responsible for the conversations. And to wrap up the story, it really is no longer relevant to ask why do people use social media. They do. Or will people use social media? They do. And social media does appear to be a trusted source, and that might possibly be due to the shared power and responsibility that is available through social media, through this kind of interactive nature. A reminder that social media requires resources. I mean, a lot of times we hear, well, social media is free, it's a good extension for a campaign, but there is a lot of staff time and resources that have to be allocated in that sense. And it does have the potential, I think, to be more cost effective and to actually be more effective than traditional media and make a greater impact. And again, that's probably due to that interactive nature. In an economically challenged environment, we may need to show return on investment. So this may be a conversation that we have to build into our plans. And so we have to explore some real creative ways to do that. Again, customer insight is one such way, but there may be some others that we can wanted to leave you with some resources for social media. So the social media toolkit that is going around is really quite nice. It includes things other than the three networks that we're engaging with. It includes e-cards and widgets and badges and things like that. So there's other guidance besides the Facebook and Twitter and MySpace. There's another resource. It's called common.com, and there's some teaching videos there on social media. They're pretty basic, but really kind of nicely done. So you may want to visit that if this is a new kind of world for you. Mashable.com is a really nice resource, and it's a blog that covers really cool and new websites, and also what's happening with social networks. So you can kind of keep up with that. The Pew Internet may be familiar to many of you. Research has several studies. It's all free data and studies and reports that give you some current idea of what's happening in the social media world. And the social media sites themselves, are very useful, such as Facebook and Twitter, for getting and compiling statistics. Blogs and newsletters, the ones that I subscribe to right now are this Social Media Examiner, and I think I get about 3 emails a week, but in very small, digestible kind of chunks. So it's not too overwhelming, and you can always dig deeper. And there's links if you're really interested in a particular topic that they bring up. And then this socialmouth.com blog was voted #1 blog for anything related to social media. So that's another good one to kind of keep up with the current trends. I mean, I think it is really important with this communication channel that you can't just fall asleep for a month and come back and be like, oh, because everything can change in a month. It's just so dynamic. So that makes it a challenge, but it also kind of makes it fun to engage with this resource. And if you want to follow Sammy, these are his addresses right now. Historic Reality is the mini website where the videos of his antics are uploaded that are more related to preconception health, but these are the basic addresses. So I'd love to have conversations with you, and if you have questions, we can talk about that. Yeah.
I have a question. I was just reading something recently, I think it was maybe with the South Carolina primaries, that those who indicated on Twitter whether they were going to support a certain candidate or not, it wasn't actually indicative of how they voted. So I found that to be so interesting because, if you're part of the conversation on social media, you think about like awareness in terms of public health, it's not necessarily indicative of certain behaviors.
Right.
So I was just kind of wondering what you thought of that. I guess that kind of goes back to how you measure the ROI.
Right, exactly. No, I mean, I don't have an answer for that. I mean, I think we're still so new and young with using this channel, and I've not seen necessarily, and these are things that we have to explore, like how do you link the behavior change in there?
Exactly.
So for the maternal child health program, we have so many different behaviors that we're looking to change, whether it's prenatal care or not smoking during pregnancy or putting your baby on its back to sleep or the right kind of nutrition. So, for this social media presence, it's not, we haven't really figured out one behavior. Now we may do that. I mean, that may be something that, okay, we're going to really focus in on using social media channel to work on safe sleep kind of environment and making sure that people take stuffed animals out of their cribs. So, is there a way to be pinpointed and see how people can work through that, and that we can gain some insights from that? So, but we're going to start simple, and we're going to go with the insights, focus group type things, so that we can show some kind of get some practice in figuring out how to measure this return. But defining the return is going to be challenging in our environments. But, yeah. Any other? Yeah.
When you were talking about having the message matrix to guide and forecast the message content for the year, did y'all do that? Of course, it's always good to have a plan, but did y'all do that because you found that if, say, for 1 week we're just going to focus on not smoking during pregnancy, were you more likely to get retweets and mentions versus kind of posting all over the place random
No, I think
bits
we
and
did it
pieces?
for our own sanity
Oh,
because
okay.
you know, this is such a small part of what I do, you know, and to be able to say, okay, what am I doing this month and this week versus having to revisit that every single week, saying, you know, what should we? So what we ended up doing was we took the calendar of health events or health topics. So SIDS is October. Infant Mortality Awareness Month or whatever. So we used that month to make sure we focused on safe sleep kind of things and SIDS. And, you know, folic acid is in January in preconception health, so we use January for that. So we use that to guide us, but not, you know, necessarily because, you know, we thought that being that kind of specific we didn't think it through like that.
But it also seems like it would help because you have then stuff to retweet if it is SIDS Awareness Month.
Right.
There's
Oh,
more
absolutely. There's more
buzz
out
about
there.
it,
That's
so
true.
you're.
That's true.
Yeah.
That is true. Yeah.
I'd be interested in your thoughts of using social media in terms of actual clinical research, where you're trying to engage a long-term longitudinal cohort study, and using this as part of a way to kind of educate, keep them involved, maybe linking to actually online tools to collect data, questionnaires, and these sorts of things.
That's an interesting question. I mean, I think there is a role for social media in this way. I mean, I haven't explored it I think it has to be thought through quite a bit. But I don't know.
Well, because practically we have a cohort of 450 HIV infected and exposed kids. Nationally, we want to follow it for 20 years. And we don't have the money to do it by seeing them every year in the clinic. So we're starting to talk about using these things to help us with building community online.
Yeah, I would sit down and really think about what it is that you want to get out of it and make sure that then everything that you do kind of funnels towards that, and just that you have a clear pathway for you know, the outcomes that you're looking for.
Have you run across anybody doing anything like that?
No, but I can look into
Well,
that.
I'm kind of in the same boat with the National Children's Study, which is my 21 year, and I love Sammy, by the way, and I follow your page.
Okay.
And I think you guys even commented on something I put up one time, but you know, I'm trying to build a community that's not just going to be participant-centered also, because you have all the confidentiality issues that surround their participation on your open page. But you know, how to serve both at the same time. And I tried using it for recruitment and fell so flat. It's hard because it's hard to measure. Because I don't know if someone liked the page, if they eventually call and want to tell me what was said. But those are some of the things that we're talking about within the National Children's Study across the country is how to, because we're really tight on budgets, how to use more social media for both recruitment and retention. And just basic awareness.
Yeah, we wanted to use, we are doing a survey right now with, actually, Wilson is helping us with that, with African American women in the New Orleans area, and it's a survey that could be online, but and we wanted to use social media to recruit and get people to hear about it, but there's issues with, you know, they have to get a unique code. And so how do we manage that? You know, so someone could take the survey like 20 times, and so that kind of was the limiting factor here. But I think there are things that we can figure out to do, but we do have to engage researchers.
Well, like I contacted our IRB when we was first putting the page together, and I mean, there's no guidance on the use of social media in the research.
Well, it's kind of, there's no guidance on this.
Yeah, I've learned a lot the last year.
Honestly, at the Department of Health and Hospitals, there's a lot of guidance on anything that's printed, but when it's electronic, you know, so we're kind of taking advantage of that right now, because once the guidance comes in, you know, we're really nervous about what we can and can't do. Now, the CDC, and I have these, this is, if you go to the social media toolkit, I can pass these around too. This gives you a little example of, you know, the guidance that they give for people in their organization who want to do a Twitter and social media kind of sites. They have it on many different things.
Yeah,
It might be a good resource. But
there's another federal institution, agency, whatever, that has a lot of kind of stuff. I can't remember.
Yeah, I don't remember the name either, but I know they're on my list. Links to look at. But yeah, I mean that's a really interesting question, and I think that it does deserve to be explored, particularly in public health research. I just don't have an answer. So, any other?
I have a totally naive question. I thought you had to be a person to have a Facebook page.
Yeah. You can make up your person.
You can't. So San Luis Historic can have a page.
Yeah.
Okay. See, I don't know any about this. I thought that there's this. I heard this stuff about aliases, though. I mean, movie stars that use their stage name, and that could have been a problem because you need to be able to identify yourself. That's not it. Oh, okay.
I think more with Twitter maybe than Facebook.
Is that from Twitter? Okay.
I think so. Although you have certainly characters and pets and whatnot on Twitter too. So
All right. It's a wild
but
west.
there has to be some.
There's a lot of uncharted territory out there. And for us in public health, I mean, again, you know, when we look back to that first slide in terms of, you know, who's using, I'm certainly not between 18 and 29, you know, so, I mean, this is not a communication tool that I'm like, this is not what I'm doing in my own personal private life the way that 18 to 29-year-olds are doing it. But I'm trying to do it in my professional life, you know, so it's a little bit different. So I have to engage personally and grow and learn there so that I can use those kind of lessons applied here. A little resistance there. Any other comments or questions?
Do you have any information on any of the demographics of some of the people that you're reaching? Because I know I've seen some numbers about, I think it was a Pew report about lower income populations are, even if they don't have a computer, they have a mobile phone that might have internet access. So it's not so much a lack of access anymore.
Right.
It's a barrier to reaching that. I didn't know if you had any.
Yeah, I mean, again, both Nielsen reports, those were the sources that I used for the earlier slides, and the Pew Internet. They have, I mean, I just showed you a few pieces that I thought just to start the conversation with, but they do look at those kind of things in terms of demographics. But I mean, it's a little tricky too. You have to be careful because you can put any age you want, or you know, when you're signing up for a Facebook account, you could be whoever you want to be. Really, I mean, not that necessarily a large percentage of people do that, but it's something to think about. Yeah, and there are other things like, you know, women are, you know, much more represented in social networks than men, except for LinkedIn. LinkedIn has more males. And then other things like with ethnicity, it's very, I mean, you have to look at the demographics of the country and of the state and things like that, but it's very skewed towards Caucasian, younger, that kind of thing. So, you know, so there's a lot of, you know, kind of background data out there in terms of who's using the Pew and internet and these social media blogs and newsletters are really good about just keeping that in your forefront.
Thank you so much. I think we need to wrap up, but we really appreciate it. Yeah, you'll be around for a few minutes. I'm just not sure. I think there might be a class here at 1. So thank you all for coming. Our theme this semester is communicating with the community. And so we'll be having one on policy campaigns, another on effective messaging, and our next one will be on February 28th, which is about branding campaigns, and that'll be from the Downtown Development District, so I hope you join us.